Hello everybody. So today we're going to talk about plantar fasciitis, one of the most stubborn and difficult problems, kind of chronic conditions of the heel and foot. If you've ever had this, you know it can last weeks and sometimes even months, and often for some patients, unfortunately, to years. And it's a very, very just difficult, kind of frustrating problem because it's often very painful when you wake up in the morning. It's painful after you've been sitting for a while. And surprisingly, it actually gets better when you kind of move more. And so this condition again, a lot of times is often even just kind of treated improperly. And so one of the things I want to kind of share with you today are some exercises that we've been using here in the office that I found to be very helpful. And the nuance with this is that we're really getting after the cause of the plantar fasciitis, which is not the plantar fascia. It's actually the medial gastroc, the calf muscle that tightens up and produces anywhere between 6 to 8 times more load on the foot with just normal walking. So what we're going to do with this, we're going to use kind of a slant board, or you can use a 2x4 at home, or in the office here, I'm just going to use a 3-inch binder. It works really, really well. And what we're going to do is just place the toes at the top of that binder with the heels just at the bottom. And from here, we're going to simply just bend through the knees to apply a little pressure to the medial gastroc. And we're going to hold it for about 45 seconds. So that's the first stretch for this. Now, after that, we're simply going to turn the toes inward to get a more targeted stretch right at that medial gastroc. Again, hold it for 45 seconds. All right, there's 5 of these stretches, and the third one, we're simply going to move this binder now out here. We're going to use the back leg, put it on the binder, and we're going to go back into what looks a little bit like a runner's stretch. We're just now going to again apply that deep pressure to, again, nice and easy. It's a gentle stretch. We're not trying to get super aggressive with it. We're just trying to apply a nice, even stretch with it. All right, the last one is kind of a kneeling stretch. Similar position. We're just going to get on the floor, put your foot right on it, and with this one, we're going to lean forward with our body to, again, apply that same stretch to the medial gastroc. Again, the key with this are these longer hold times. We're not holding it for 8 seconds, not 10 seconds, but for a full 45 seconds in that position. Now, the last one, we're going to use a strap. And now, sometimes people can get super aggressive with these, which is why I like using a TheraBand. So a TheraBand works really well. If you have a rope or a strap, that's fine. The key, again, is just kind of pull it across from the big toe. And with this, we're going to apply a little outside pressure. Pull it towards the pinky toe, and again, feel that stretch on the medial gastroc in that kind of medial part of the calf side. Hold it again for 45 seconds. That's the key. Again, just a gentle, gentle stretch. These stretches I find usually work a lot better than the typical like dropping the heel off of the staircase, or when people kind of aggressively get after the runner stretch. Again, just keep it nice and gentle for a lengthy time period. Now here's where it kind of gets a little interesting. So with these exercises, we're going to do them 5 times a week, twice a day. So 45 seconds, 5 exercises, twice a day. We're talking anywhere between 9 minutes or so. Then every 3 weeks, we're going to increase it by 15-second holds. So 45 seconds to a minute 15, eventually to a minute 30. For a total of 12 weeks. That's how long this program is going to take to show that effective increase of length of that medial calf, which is going to give us better mobility at the ankle and take the load off the plantar fascia. Hopefully these exercises are quite helpful for you. In our office, we can help you with this issue and a lot more. We typically use active release technique, a soft tissue technique that's really great at breaking up scar tissue in the calf, in the foot. We can also use acupuncture and dry needling. So there's lots of tools that we can throw at it, but try these exercises at home and stick with them. Hang in there. The plantar fasciitis is one of very frustrating kind of things to work with, but if you hang in there for a few weeks and put the time in, you will see the results. Hopefully that'll help you.